Hello everyone. Let me switch off this light. Okay, that's better. Okay. So, come on, jaldi join kari. We have to do this paper. There are 40 questions. We have to do at least 20 questions today. आधा paper तो आज solve करें. Are you all busy in the other classes? Because I know आप लोगों की back-to-back classes चल रही हैं. And if you don't think this time is suitable, then we can do it later. The thing is that MCQs में it is not like I keep talking and then you can watch it later. MCQs में अगर आप participate करेंगे तभी फ़ायदा है. Hello इश्तियाक. Are you a student इश्तियाक? Hello Ehsan. Hello Duri. Hi Rabi. So some of the students. You're not a student Ishtiyaq? Okay. So anyway, you can listen to this session, but what we are doing right now is UPSC 2013. Storytelling for kids. You need to ask a question? Okay, you can. Although this session is only for the students. So anyway, you can ask. Tell me. Okay, Ehsan, you're a student doing post-graduation in Gynae, Obs and Gynae? So shall we start with the questions? Have you seen the PDF जो मैंने Telegram channel पे upload करी थी? I have uploaded a 2013 UPSC paper in the morning and I want you to go through that paper and let's start with question number 1. Okay. Okay, M. Ehsan, you're a girl married to... Okay, fine, that's fine. Duri, right. So, is it only just one student we have out of the 13 people watching? Because I'll be reading out the question and then telling you the answer. Okay, anyway. Pehla question kya hai? Pregnancy is characterized by the following physiological changes except... Let me see if that's the first question which I have posted here. Let me just check the paper. Yes, that's the first question. Pregnancy is characterized by the following physiological changes except which one is not a physiological change in pregnancy? Delayed gastric emptying time, dilatation of the uterus, decreased glomerular filtration rate, that is GFR, and increased tidal volume. Tell me. Okay, storytelling for kids. This is not a channel where you should be asking your questions. Cesarean के बाद पेट में बहुत तेज दर्द होता है पूरी बैक में. आप आस्क योर गायनेकोलॉजिस्ट जो मेरा दूसरा चैनल है उस पर आइए बिकॉज अभी बहुत कंफ्यूजन हो जाएगा. मैंने क्लियरली बताई सिर्फ स्टूडेंट्स के लिए है और इन लोगों का पेपर आ रहा है 2022 का 17 जुलाई को पेपर है. थैंक यू इश्तियाक. सो ये जो पेपर है इसके लिए हम तैयारी कर रहे हैं. ठीक है, तो स्टोरी टेलिंग फॉर किड्स. आपने ये जो क्वेश्चन पूछा है सिजेरियन के बाद पेट दर्द हो रहा है, मैं बता दूं आपको डॉक्टर को चेक कराना पड़ेगा. ठीक है अमित, ये जो चल रहा है सेशन ये स्टूडेंट्स के लिए, दिस नॉट फॉर पेशेंट्स. ओके, डिक्रीज GFR इज द आंसर. यूर राइट. डिक्रीज GFR नहीं होता है, इंक्रीज GFR होता है. ओके, सो मैटरनल एडेप्टेशंस में हमने पढ़ा है कि ग्लोमेरुलर फिल्ट्रेशन रेट जो ब्लड सप्लाई ऑफ द किडनी है एज वेल एज द GFR इट ऑल इंक्रीजेस. राइट. सेकेंड क्वेश्चन इज डोनोवान बॉडीज आर एसोसिएटेड विद व्हाट? गोनोरिया, क्लेमीडिया ट्रैकोमैटिस इन्फेक्शन, हर्पीज जेनिटालिस या फिर ग्रैनुलोमा इंग्वाइनल. Donovan bodies are associated with what? A, B, C, D. So how come it's only one student answering? I think बाकी सारे patients हैं, students नहीं हैं. Telegram channel पे मैंने लिखा था, but somehow मुझे लगता है आप लोगों की classes clash हो रही हैं. Granuloma inguinal is the answer. Yes, Ravi Shankar, it's absolutely right. Donovan bodies are seen in granuloma inguinal. Okay. Donovaniosis, Klebsiella granulomatis is the causative agent. During pregnancy, vaccination can be given against all the diseases except hepatitis A, mumps, tetanus और hepatitis B. इन चारों में से कौन सा वैक्सीन प्रेगनेंसी में नहीं देते हैं? Which one is not safe? Anything which is live any live vaccine cannot be given. That is not safe. You are right, Duri. It is mumps. I will call you Ravi because it's a long name, Duri Ravi Shankar. Yes, mumps. Yes. So that's M. Ehsan again. So two people are answering. That's fine. Mumps is the question. Is the contraindicated one because it's a live vaccine. The live attenuated vaccines, MMR, and there are other ones as well, which I have told you in the chapter. There is, I think it is HITR. These are the vaccines which are not recommended during pregnancy. What is the likely cause of primary amenorrhea together with retention of urine in an adolescent girl? Likely cause of primary amenorrhea together with retention of urine in an adolescent girl: Turner syndrome, adrenal hyperplasia, hematocolpos एंड टेस्टिकुलर फेमिनाइजेशन सिंड्रोम. इनमें से कौन सी कंडीशन में यूरिनरी रिटेंशन होता है यंग गर्ल्स में? Hematocolpos is the answer, yeah, right? Hematocolpos में the vagina is completely occluded with blood. It is filled with blood, so it kind of just pulls the utrovesical ligament, and that causes urinary retention. You are right, both of you. Fun with Fun Zone, you are a hematologist. Okay, this session is for the UPSC Gynec OBGY, that's obstetrics and gynecology questions. And we are discussing 2013 paper. Histological type of endometrium that is suggestive of ovulation is what? Proliferative phase आ रहा है histology में, secretory phase आ रहा है, cystic glandular hyperplasia आ रहा है, या फिर adenomatous hyperplasia आ रहा है? What is the yes secretory phase? That is correct, and it is done at day 21-22, and the serum progesterone is also done at day 21-22. Yes, both of you are correct. It is secretory phase which suggests that progesterone is getting secreted, and that means it is a ovulatory cycle. Furning of cervical mucus is due to high concentration of what? Sodium chloride, potassium chloride, sodium bicarbonate, या फिर potassium bicarbonate. Okay, Ravi, you have already answered. I'm waiting for the other person to answer. Ehsan. Very simple questions. UPSC paper is not that difficult as compared to NEET, PG, and of course INI-CET. Yes, you are right. Sodium. It is not sodium bicarbonate, Ehsan. It is sodium chloride. It is NaCl. Okay, salt, which causes furning. Pregnant woman in third trimester has normal blood pressure in the arms when standing and sitting. Okay, when she is in the third trimester, pregnant woman, she is. Let me read out the question, Duri, Ravi. In the third trimester, she has a normal blood pressure in the arms when standing and sitting, but it drops down to 90/50 when lying down. What is the likely cause? Why is it dropping down? Compression of uterine artery, aorta, inferior vena cava, या फिर internal iliac artery. Okay, the other person, Ehsan, you want to answer? Okay, compression of inferior vena cava is the right answer. You're right. Okay, which of the following statement is not correct about fetal circulation? Confused? ऐसा it is inferior vena cava. That is the reason why हम लोग patients को बोलते हैं कि आप left lateral so left side बाईं करवट के पे क्यों लेटाते हैं? Because right side में inferior vena cava होता है. Inferior vena cava यानी कि जो बड़ी वाली vessel है, हेलो सपना, ये जो बड़ी वाली वेसल है जो वीनस रिटर्न लेकर आती है लेग्स से टुवर्ड्स द हार्ट, दैट गेट्स कंप्रेस. इट इज अ वेन. आर्टरीज कंप्रेस नहीं होती. वेन्स की जो वॉल होती है वो बहुत पतली होती है. इट गेट्स कंप्रेस्ड, इसीलिए पेशेंट को लेफ्ट लैटरल लेटाते हैं. ओके, सो दैट इज द रीजन व्हाई देयर इज सुपाइन हाइपोटेंशन. तो फीटल सर्कुलेशन वाला कौन सा स्टेटमेंट गलत है? It is not correct. Umbilical artery carries oxygenated blood to the fetus. Umbilical vein carries oxygenated blood to the fetus. Umbilical artery carries deoxygenated fetal blood to the placenta. 2 umbilical arteries and 1 umbilical vein traverse through the umbilical cord. इसमें से कौन सा गलत है? रवि, आपके पास तो क्वेश्चन पेपर खुला हुआ होगा. I think the other person doesn't have the question paper. Ehsan, you can join my Telegram group. Let me paste that group here. Umbilical artery carries oxygenated blood to the fetus is wrong. That is absolutely right because oxygenated blood नहीं deoxygenated blood आता है. Let me just paste the Telegram channel link here so that anybody who wants to join, who is a student or doing PG, we are discussing gynecology all the time here, and I keep posting my lectures. I'll keep posting my lectures and taking more lectures as long as people keep telling me कि मैम ये lecture ले लो, ये वाला topic पढ़ा दो, ठीक है? Then, which of the following is a contraindication for breastfeeding? सपना, दिस इज नॉट द प्लेटफॉर्म, यहाँ पर क्वेश्चन मत पूछिए. दूसरा प्लेटफॉर्म है आस्क योर गायनेकोलॉजिस्ट, वहां पर क्वेश्चन पूछिए, ठीक है? यहाँ पर सिर्फ स्टूडेंट्स को पढ़ाया जा रहा है. विच ऑफ द फॉलोइंग इज द कॉन्ट्राइंडिकेशन? मैटरनल डायरिया, मैटरनल ट्यूबरकुलोसिस, फर्स्ट 24 आवर्स आफ्टर सिजेरियन, या फिर नन ऑफ द अबव. कौन सा कॉन्ट्राइंडिकेशन होता है कि ब्रेस्ट फीडिंग नहीं करानी है? किस कंडीशन में नहीं कराते हैं? नन ऑफ द इज द आंसर, ठीक है? एक्सेप्ट फॉर HIV. अब उसको HIV को भी हटा दिया गया है. HIV पॉजिटिव मदर को भी आजकल ब्रेस्ट फीडिंग के लिए मना नहीं करते. पहले मना करते थे व्हेन वी वर डूइंग PG, बट अभी देयर इज actually no contraindication. It is not maternal diarrhea. Who is Sal? Sal, are you a student? Because the answer is none of the above. Okay? None of the above is the answer. There is no contraindication for breastfeeding unless the mother is having active tuberculosis. इसमें ऐसा कुछ लिखा नहीं कि कौन सा ट्यूबरकुलोसिस है. इवन एक्टिव ट्यूबरकुलोसिस में इट इज़ बेटर टू बेसिकली कवर द पेशेंट्स माउथ इफ शी इज हैविंग पल्मोनरी ट्यूबरकुलोसिस एंड देन लेट द बेबी हैव ब्रेस्ट फीड. यू मे नॉट गिव अ डायरेक्ट फीडिंग, यू मे नॉट गेट द बेबी नियर द मदर. बच्चे को डायरेक्टली मदर के पास मत लाओ. गेट द ब्रेस्ट फीडिंग express the breast milk can be expressed in the bottle or in a bowl, and then that can be fed to the baby. Okay, so why to deprive the baby from the mother's milk? You should not deprive the baby from the mother's milk because that is very, very important. Okay, Meconium aspiration syndrome can be prevented by taking the following measures except. Okay, Sal, so join us now. Have you seen the paper 2013 जो मैंने अपने टेलीग्राम ग्रुप में डाला है? अगर वो पेपर आप खोल सकते हो तो खोल लो. क्वेश्चन नंबर 20 इज Meconium aspiration syndrome that can be prevented by taking the following measures. और आपकी PPT में वो क्वेश्चन नंबर 10 होगा बिकॉज वो 11 से स्टार्ट हुए हैं, ठीक है? सो टेल मी द आंसर, रवि. Meconium aspiration syndrome can be prevented by all except one. Amnio infusion, oropharyngeal suctioning, suctioning of trachea through laryngoscope, या फिर delivering the baby by emergency cesarean section. कौन सा ऐसा ऑप्शन है जो कि Meconium aspiration syndrome से नहीं बचाएगा? Okay, anybody else? That is not the right answer, Ravi. How can you prevent Meconium aspiration from the baby? Okay, Ehsan, no, that is not the answer. The answer is amnio infusion. Okay, amnio infusion is the answer because oropharyngeal suctioning तो करेंगे when the baby is born. How will the pediatrician treat the baby? They will do the suctioning. They will put a laryngoscope. They will try to suck it out as far as they can go. Suctioning of the trachea is very important. Delivering the baby by emergency cesarean section is the main thing. Once you see meconium, thick meconium coming out, and the deliveries will take time, you don't think that the delivery is going to happen in 5-10 minutes. Deliver the baby by cesarean section. The only thing which cannot prevent is amnio infusion, because even if you are infusing fluid inside, even then the baby will drink the meconium. Okay. Then next question. A 15-year-old unmarried girl comes with history of dysmenorrhea. Age of menarche is 12 years. Okay? तो 15 साल की लड़की है, अनमैरिड है, उसको डिस्मेनोरिया हो रहा है और उसको 12 साल पे पीरियड स्टार्ट हुए थे. पर एब्डोमिनली, पर रेक्टली एग्जामिनेशन कुछ नहीं गड़बड़ मिल रहा है. तो नाउ हाउ विल यू ट्रीट द पेशेंट? एंटीबायोटिक्स, हॉर्मोन्स, रीएश्योर एंड गिव एंटीस्पास्मोटिक्स, या फिर रीएश्योर एंड गिव एंटीस्पास्मोटिक्स ड्यूरिंग मेंसेस? थ्रू आउट द मंथ दोगे कि ड्यूरिंग मेंसेस दोगे, या फिर एंटीबायोटिक्स दोगे, या फिर हॉर्मोन्स दोगे? वेरी वेरी सिंपल. जस्ट अ वेरी सिंपल क्वेश्चन that you should be answering because you will be like probably working as an RMO. Reassure and give antispasmodics during menses. That is correct. Yes, Sal, it is D. Okay. So next question. A pregnant lady with 37 weeks gestation. So this kind of dysmenorrhea is spasmodic dysmenorrhea, which is very common in young girls, unmarried girls who have never conceived also. Okay. Pregnant lady with 37 weeks of gestation has been admitted with history of PROM for 6 hours. She is best treated with what? 37 weeks है, प्रेग्नेंट लेडी, प्री मेच्योर रप्चर है यानी कि लेबर में नहीं है, अब आप उसको 6 घंटे से हो रहा है. नाउ हाउ विल यू ट्रीट हर? Steroids followed by labor induction, steroids and antibiotics, steroids and tocolytic agents, antibiotics followed by labor induction. क्या दोगे आप? 37 वीक्स है, 3 ऑप्शंस में स्टेरॉइड्स है, लास्ट ऑप्शन में स्टेरॉइड नहीं है. एब्सोल्युटली राइट रवि. एंटीबायोटिक्स देंगे. सैल वी विल नॉट गिव स्टेरॉइड्स एट 37 वीक्स. 34 वीक्स के बाद स्टेरॉइड्स की जरूरत नहीं है. सो यू कैन गिव अर एंटीबायोटिक्स एंड इंडक्शन भी करने की जरूरत नहीं है बिकॉज नॉर्मली 24 आवर्स के बाद ये अपने आप ही नो इट इज डी. It is DSR. Antibiotics followed by labor induction because इनके अकॉर्डिंग 6 आवर्स हो गए you should induce labor. But technically, practically and even theoretically 24 hours तक we can wait for the labor to start itself. Okay. Next question. Use of ventouse is preferred over forceps in the delivery of what? Ventouse कब better होता है forceps से? OP position, after coming head in breach, face presentation या फिर fetal distress. किस condition में ventouse is better? रिमेंबर वाई वेंटूज के एक्स्ट्रा एक्शंस क्या है, एक्स्ट्रा बेनिफिट क्या है अपार्ट फ्रॉम फॉरसेप्स जो फॉरसेप्स में नहीं होता है. ओके रवि, एनीबडी एल्स? Anyone else? No. Okay. So the answer is correct. Ravi, OP position because ventouse बच्चे को rotate भी कर देता है. Ventouse is used for even DTA, deep transverse arrest. Maybe we try to rotate the baby along with the ventouse. So either we can do a manual rotation or yes, Ehsan, you're right, or we can do a ventouse rotation. बाकी face presentation में we cannot put a ventouse on the face. After coming head in breach, no way. You have to apply the forceps. Fetal distress में ventouse will not work. You have to apply something stronger so that you can pull the baby out. Okay. So it is OP position. Normal pH of fetal scalp कितना होना चाहिए? 7, 7.2, 7.1, 7.3. So 7, 7.1, 7.2, 7.3 कितना होना चाहिए? All are very close. What should be the normal pH? और pH acidic होता है कि alkaline होता है? These are all alkaline. Okay? Yes, you are right. 7.3. During labor, normal scalp pH should never be less than 7.25. Okay, so 7.3, 7.25 से 7.35 के बीच में होना चाहिए. अगर वो 7.2 या उससे नीचे जा रहा है, that means the baby is getting acidotic, the baby is getting hypoxic. Okay, and we used to do a lot of fetal scalp blood sampling. FSB हम लोग बहुत करते थे in UK when we were practicing when we were doing MRCOG. इंडिया में अभी तक कॉमन नहीं है. फेस टू प्यूब्स डिलीवरी इज कॉमन इन विच टाइप ऑफ पेल्विस? ये मैंने आपको बताया हुआ है. देर आर एंड्रॉइड, एंथ्रोपॉइड, गायनेकॉइड एंड प्लैटिपोलॉइड पेल्विस. तो किस पेल्विस में फेस टू प्यूब्स डिलीवरी हो जाती है? रिमेंबर द पेल्विस जिसमें एपी डायमीटर इज मोर देन द ट्रांसवर्स डायमीटर, उसमें होती है एंथ्रोपॉइड. एब्सोल्युटली करेक्ट. एंथ्रोपॉइड पेल्विस में फेस टू प्यूब्स डिलीवरी हो जाती है. इवन दो एंड्रॉइड पेल्विस में भी फेस ये डायरेक्ट ओपी पोजीशन बहुत कॉमन है बिकॉज दोनों में ही एपी डायमीटर ज़्यादा है. बट एंथ्रोपॉइड में वो हार्ट शेप नहीं है, एंड्रॉइड में हार्ट शेप है, तो बीच में इंडेंटेशन आ जाता है, तो इट कैन नॉट डिलीवर. फेस टू प्यूब्स डिलीवरी नहीं होती, वो अरेस्ट हो जाता है उसमें. ठीक है, तो आंसर इज एंथ्रोपॉइड. फॉलोइंग आर द साइंस ऑफ प्लासेंटल सेपरेशन एक्सेप्ट यूट्रस बिकम्स हार्ड एंड ग्लोबुलर, फंडल हाइट डिक्रीजेस, परमानेंट लेंथिंग ऑफ कॉर्ड, फ्रेश ब्लीडिंग अकर्स. इनमें से कौन सा गलत है? We will do half the questions today, that is 20 today and 20 next time. Because we don't have many students today, it's just 3 people participating. Fundal height decreases, absolutely right. Fundal height will increase because the placenta is going to occupy the lower segment and the vaginal area, so the uterus will be pushed slightly up. Following conditions are associated with molar pregnancy except what? Which conditions are associated with molar pregnancy? PIH, gestational diabetes, thyrotoxicosis या फिर hyperemesis gravidarum. मोलर प्रेगनेंसी के साथ कौन सा कंडीशंस एसोसिएट नहीं होता है? एक्सेप्ट पूछ रहे हैं. ऑल ऑफ देम कम विद मोलर एक्सेप्ट वन, and that is because of the HCG hormone. The excessive HCG hormone secreted in molar pregnancy can lead to many other conditions except one. No, it is not the right answer. Yes, it is diabetes. Diabetes has no relation with HCG. Question has been taken from a comprehensive textbook of obstetrics and gynecology. Molar pregnancy is characterized histological by abnormalities of chorionic villi, which consist of lot of HCG hormones. So gestational hypertension, hyperemesis gravidarum, and thyrotoxicosis, because HCG and TSH have similar alpha units, so they can mimic each other. Okay, so it is only diabetes. What is the commonest cause of retention of urine at 12 to 14 weeks? 12 to 14 weeks, when the uterus is just becoming an abdominal organ, where end of first trimester, retention क्यों होता है? Impacted pelvic tumor, diminished bladder tone, retroverted gravid uterus, prolapse of uterus. What is the most common cause of retention of urine at 12 weeks? Retroverted gravid uterus, yes. Generally, if the uterus is retroverted, it gets self-corrected by 14 weeks, because once it becomes an abdominal organ, the uterus will be pulled up. But sometimes it doesn't get pulled up, and it might cause more retention because it is just pulling the bladder back. Okay. Second last question, which of the following is a uterine compression suture during management of atonic PPH? Sturm-Dorf suture, B-Lynch suture, Fothergill suture, Moskowitz suture. Very easy, because I've taught you in the PPH chapter. In PPH, I've taught you this thing. Ravi, are you a part of this UPSC sessions which were going on? B-Lynch suture, absolutely right. So are you a part of that session which is finishing on the 16th of July? Are you still there, or have you left? Yes, okay. So is anybody else taking gynec lectures there? Because my contract is over. Is anybody else taking it for you in these 15 days? Or is it only surgery, medicine, and PSM going on, and pediatrics? There's nobody taking gynae, obs and gynae. Okay, fine. So anyway, what we can do is you can tell all the students, because I don't think all of them are on Telegram, or if they are, then maybe they are not aware that I'm taking these classes, because we still have 2021, the latest paper to discuss, and then there are some theory classes left which we can do on my YouTube channel. Keep telling me the topics and we can take that, because जो topics मैं ले चुकी हूँ, that you already have with you, because you have already paid for that and you can access them anytime. But the topics which are left, I will put a list in the Telegram group, and then you can tell me which lecture you want, because 45 minutes, 1 hour I can teach on the YouTube. Okay. So yeah, the answer is B-Lynch suture. And the last question for today, which of the following antihypertensive drugs is or are avoided during pregnancy? Which of them are avoided? Labetalol, alpha-methyl dopa, nifedipine, या फिर angiotensin converting enzyme inhibitors. They are not used in pregnancy. Very simple. We have done this. ACE inhibitors, yes, because they can lead to IUGR. Okay, so that is it. We will meet again. Maybe once the people start responding in Telegram group that when they want the session, I can take it tomorrow also, I can take it day after tomorrow also. Let me know, please answer in the Telegram group when you want the session and what time you want the session. Okay, bye bye, take care, and see you all next time. Okay, bye bye.